m.o.i.s.t and wax in between the T1s conjunctiva. Right here in this pocket, so it's not exposed to the sclera, and we remove this back after the 20-30 seconds time period to a full count. That's the conjunctiva and T1s here. Very good. See that? Yes, clear? So the three important steps that I want eye surgeons to undertake when performing Pterygium or Pinguecula surgery so they can have results the way we have enjoyed for the last 3 decades, where our patients come with these very red eyes with very aggressive Pterygiums or Pinguecula that are cosmetically unappealing and creating symptoms, and land them straight to sparkling white eyes, where we even correct the dry eyes and the patients are made to walk up to the mirror day 1 after surgery and then followed up for years for the excellent rate that we have of preventing recurrence. The 3 most important steps during surgery. Number 1, what you're looking at, that Pterygium or the Pinguecula on the eye, is just the tip of the iceberg. So you've got to dissect the entire length of that Pterygium or Pinguecula right up to the angle of the eye, and that we are removing the entire mass. Step 2, delineate the difference between the tenons and the conjunctival layer, and you'll see that in my video, and I show it like a pocket. And that pocket is where you put the mitomycin-C VEC cells, and then you remove that from there. So that's the area of recurrence, and you must make sure you close that pocket with glue, is what I do in my technique. And number 3, very important, trace the pterygium and the associated scars right up to their tentacles that go right into the angle of the eye, and go right to that angle, and that literally lifts off that entire lesion with minimal bleeding, because we actually went in the correct plane of the pathology rather than creating different planes. So if you follow this principle, you will be removing the entire lesion, you will be artistically creating the anatomy that that patient should have had to begin with, and the recurrence rate will be extremely low, and the patient's satisfaction is tremendous looking at the sparkling white eyes, especially if you use the way I use no-stitch glued amniotic techniques, is using the amniotic graft on the dissected sclera. So if you follow these principles, you will see that the results will change, your patient's comfort will change, and a welcome side effect, their dry eyes also improve because of the amniotic tissue, and their vision improves because you're doing a no-cut technique. There are no cuts and no blades in the cornea. So try that, and I'm here for any questions, and if you have any more information you need, we have actually authored an entire textbook on my experience of pterygium surgery over 3 decades. It's published by Theme. Theme is an international publisher based in Germany and New York, and now in Asia too. You can go online and look up all the information, or go to our YouTube channel. There are thousands of videos, and you can look at that and call me or email me with any questions. So wish you the very best, and do fight for your Pterygium Pinguecula patients and bring them to a functional, cosmetic and visual outcome if you follow these steps that I just mentioned. Dr. Gulani.